For over 15 years, the Neck and Back Medical Center has been helping people in pain and is now proud to announce the introduction of a new medical treatment plan for people that suffer from numbness, burning sensation, or stabbing pain to the feet or legs, commonly known as peripheral neuropathy. The medical treatment plan uses state-of-the-art technology that has been cleared by the FDA to treat the burning sensation, numbness, or stabbing pain to the feet and legs.
We tried it, and my feet had a lot of pins and needles in them. They don't now. I could tell the difference after the first treatment.
This medical treatment plan offers hope to be pain-free for those that suffer from this crippling pain.
I'd recommend it to anybody that's got diabetes or anything that's got, the feet are bothering them. Insurance company paid for all of it.
If you or someone you know are suffering these symptoms, then please call the Neck and Back Medical Center today for a free consultation with one of our doctors.
Welcome back, folks. Quite often we've been showing a few segments on the Neck and Back Medical Center, and we're great to have them back from their two doctors from that facility located in Laguna Hills. And Dr. Corey Gould and Dr. Robert Sklar are here. And Corey, you've been here before,
yes,
haven't you? Welcome back.
Several times, thank you.
Yeah, and welcome to you. I don't know if you've been on before.
I have been.
All right, well, welcome back to you,
Thank you.
as well. Dr. Gould, tell me a little bit about the Neck and Back Medical Center. I know you do a lot of different things over there, and one of them is to manage pain of people.
Yes, we're a multidisciplinary center, meaning that we employ medical doctors, physical therapists, chiropractors, all in one facility. And we specialize in the treatment of back and neck problems, but more specifically, we're doing some very good things with neuropathy patients as well. And what is, Dr. Sklar, what is neuropathy? People have probably heard of that, and for me, I wasn't really sure what it was. I looked up a little bit information on it, and sometimes it's called peripheral neuropathy for short. Give us kind of an overview what it is. It involves a lot of different things, doesn't it?
There's a lot of information, but let's think of neuropathy as a symptom rather than a disease. Most of the people that we see with neuropathy come in with either complaints of burning, stinging, numbness, tingling, or weakness in an extremity. It could be the hands, it could be the feet. More likely it's in the feet. But these are usually symptoms of an underlying problem. For example, people with diabetes will frequently have what we call peripheral neuropathy. Certain medications will bring on neuropathy. Certain exposures to chemicals, infections, metals can bring on neuropathy. Sometimes, frequently we see it after surgery, specifically back surgery. Lately we've been seeing a lot of patients who have undergone chemotherapy for other reasons. And because of the drugs, they can damage the nerves. So let's think of neuropathy as damaged nerves, whatever the cause.
And as you just said, the causes can be numerous.
Numerous and multiple. And frequently we can't get to the underlying cause. Up till recently, there hasn't been any real effective treatments. Primarily the treatment would be medication, using various medications, antidepressants, tranquilizers, anticonvulsant drugs, etc. Up until recently, we haven't had a real effective treatment. So through the last year or two, we've been very fortunate in that one of our employees, who's a PhD in biomedical procedures, has come across and invented a new procedure using radio waves to help heal the nerves. So our therapy is now somewhat new under the direction of both medical doctors and physical therapists, which is kind of unique here in Orange County. Most therapy here in Orange County is done by non-medical people. So in our clinic, we use multiple things, including physical therapy, lasers, radio frequency. I personally have been involved utilizing high doses of vitamin B and anti-inflammatory agents that I directly inject near the damaged nerves to promote healing. So the results over the last year or two have been very, very well. This gives new hope to people who prior had no therapy or no hope at all. So our results have been very impressive over the last year and a half.
Some of the things that I've read on here, which I was surprised that the wide range of neuropathy there is for something very, I would say, more common, carpal tunnel syndrome, all the way where you can get a sudden paralysis to what they call a foot drooping or foot drop, where you get it somewhere in your leg and you can't lift your leg or your foot up over a small threshold. Dr. Gould, it's very wide ranged, isn't it? And to pinpoint that.
It is, and when you mentioned the gait and balance issue of it is a major problem for people.
Mm-hmm.
As the balance starts to be affected by the nerve damage in the feet, we see a lot of people falling, and then more problems, medical problems, arising from those injuries.
Dr. Sklar, do you feel that, or have you seen, I should say, in reading over a little bit of this, in which you said people who are taking treatments for other diseases, diabetes, cancer, things like that, does this sort of heighten the possibility of neuropathy or in effect cause it?
Yes. Fortunately, being a medical doctor, I'm been trained and capable of investigating all these different parameters.
Mm-hmm.
Just very briefly, neuropathy can be three different types. Motor neuropathy, that's damage to the motor nerves,
mm-hmm.
can lead to foot drop. Foot drop means you could trip, you could drag your foot, you could snag it on something. Think of motor neuropathies like after a stroke, for example.
Right.
Sensory neuropathy is the kind that you experience lack of sensation, sometimes burning or stinging, and these are diabetic patients and other medical problems. And then there's autonomic, that means automatic nerves. These are the ones that control the bowel and the bladder and heart rate. These we cannot do very much about except recognize them and treat them medically.
Mm-hmm.
Our area is primarily the sensory and the motor nerves. Now we've come across some types of screening procedures just recently that measures the degree of damage in the nerves. And through our free screening program that's coming up very shortly, we are able to do the screening procedure at no cost to the patients. Normally it would cost, and it is not a covered benefit from Medicare, but for our purposes and community service, we are going to do a free screening program using this nerve testing device.
Okay, and we have a number. One number that we were given, you have a better number to call that's on your ad, which is the 949-859-6600 number to call, and you're down there in Laguna Hills. One thing I want to ask about this, I'm looking at some of the symptoms here: tingling, numbness, loss of sensation in arms and legs. Should people be looking out for this, that it becomes chronic? We all wake up in the morning sometimes, you slept strange, and your arm's a little numb in the morning or something like that, but then it, within 10, 15 minutes, it pretty much dissipates. Is this something, if you do have this or beginning to have it, your numbness is going to come back or last much longer?
Well, it's the same in medicine in general. The earlier you can get a treatment or diagnosis or recognition of a problem, the better the results are. So,
okay.
Obviously, if it's a transient or just a few seconds or a few minutes and it goes away, let's not be concerned. But if it's more than that, days and weeks,
mm-hmm.
it does need some investigation. And I'm kind of, lately I've been hearing this, and I'm not sure it's a right thing to say, but a lot of the primary doctors in the neighborhood say neuropathy is just part of aging. Mm-hmm. And we disagree very much with that, in that if we can catch it early, we can make a difference.
Great. Dr. Gould, what other services do you offer there at Neck and Back?
We're one of the few spinal decompression centers in the community. We've got some very specific back strengthening equipment called
mm-hmm.
MED-EX, which is very rare as well. And essentially we treat, although the name being neck and back, we treat all kinds of extremities: shoulders, knees, hips, anything that requires any type of physical therapy or rehabilitative services.
So if somebody, whether or not they have chronic injury, their back or neck or something like that, but also if they had some sort of injury, is that something that they could come to you? In other words, it's causing pain. The injury's already been looked at, but there's some chronic pain that's associated with it as well.
Any type of acute injury certainly is treatable, and we've actually kind of become known for treating the chronic long-term pain patients because our success rate has been much greater and much higher than just your traditional therapy center.
Okay, very good. And again, you're located in Laguna Hills. What's the, you're on Merritt Circle. What's the cross street there?
Merritt Circle is right off of Cabot Road.
Okay,
and
Sure.
Pacific Park is the nearest intersection,
Yeah,
right
I
off
know.
the 5 freeway.
I know where that is. And this is the number that they prefer that you call, 949-859-6600, Neck and Back Medical Center. And doctors, I thank you for coming on. Really good information about neuropathy.
Thank you.
There's a lot to it, and as you were saying, that if people feel that this might be something that they have with some ongoing numbness or tingling, give you folks a call, and you can check them out further and see. Thank you.
Yeah. And again, this Saturday we're offering a screening to anyone who wants to come down. It's complimentary, and
Yeah,
you're
it's
welcome to
Saturday
call
at
us.
9 o'clock, 9 to 2, and this is a great time for you folks to come down there. And will you do like a kind of a quick history and ask them basically what's bothering them, and maybe I know there's some kind of things that you can do just to, I've seen where they can check out your spine and very quickly and just see if there's something that you can provide for them.
Yeah, it's quick, painless. We'll have a brief questionnaire that they fill out about their symptoms. We'll do a consultation with them at no charge, and we have a device that allows us to test the nerves in the legs to see if there is a true neuropathy.
Should they call to make a reservation or just show up?
Yeah, if they could call.
Okay,
set up
again,
a
we
time.
put the correct number on the screen, thank you. So go ahead and call them, and also their website is neckandback.net if you want more information. And thank you, doctors, again for coming on. Check them out this Saturday, February 23rd, from 9 a.m. until 2 p.m. for their free screening down in Laguna Hills near Cabot Road on Merritt Circle there. Doctors, thank you very much.
Thank you.
I appreciate you for coming in today. And coming up next, we have the Florence Sylvester Senior Center. We'll be right back.
Certainly one of the things I would explain to patients considering back surgery is they absolutely need to reconsider back surgery.
If you're suffering from neck or back pain and have not called the Neck and Back Medical Center for a free, no-obligation consultation, time is running out for this offer. Just listen to some patients who did call us.
Hi, my name is Cher, and I love Neck and Back Medical Center. I was in excruciating pain for over 4 years. I found this facility through a friend, and now I am out of pain. I had lower pain that used to shoot down my leg, and it was horrible. And now, after going through treatments with some wonderful, wonderful people who really care about you, I can run, I can jump, I can exercise, I can do anything I want to do, and I am so happy. I am so grateful. Thank you, Neck and Back Medical Center. You guys are amazing.